Hi everyone, my name is Camille Paginto, and today I will be talking about a chemotherapeutic drug known as tamoxifen. So, a little bit of background: tamoxifen is used in the prevention or the treatment of breast cancer. It is a drug that binds to the estrogen receptor, and this causes a conformational change in the receptor, and it is also able to block any estrogen signal activity in mammalian tissues, such as in the breast or in the uterus. Um, so over here I have an example of an estrogen that is being blocked by a tamoxifen that is bound to an estrogen receptor. So this blocking can actually prevent any cell growth, it shrinks any tumors, and the cell is able to die. In addition, it can also reduce the DNA polymerase activity, it can impair thymidine utilization, it can block the estradiol uptake, and of course, it decreases estrogen. Up here is a picture that I got from the textbook. So, this is an example of two of the four different types of breast cancers. So, here we have luminal A and luminal B. And basically, this is showing the estrogen receptors right here in the red that is present, as well as any PR receptors and HER2, which is a growth factor receptor. So, tamoxifen interferes with the estrogen signal pathway. Over here, we have an example of estrogen in the breast cancer cell. So, estrogen binds to the estrogen receptor, and thus it binds to a short DNA sequence known as estrogen receptor element. This activated estrogen receptor binds to a coactivator protein, and it can induce cell proliferation. On the other hand, we have tamoxifen that binds to the estrogen receptor, and thus estrogen is being blocked. And so when tamoxifen binds to this receptor, it blocks the coactivator protein, and the signal pathway is interrupted, and there is no cell proliferation. On the other hand, we have here estrogen receptors in a normal cell. So the estrogen still is able to bind to the estrogen receptor, it binds to the DNA sequence, and this triggers cell proliferation. So tamoxifen can have many major side effects. Some good side effects includes the reduced risk of estrogen receptor breast cancer, and it can lower LDL cholesterol. On the other hand, some bad side effects includes the development of uterine cancer, an increased risk of blood clots or venous thromboembolism. It causes menopause-like symptoms such as hot flashes, fatigue, and headaches. This is because tamoxifen can act as an estrogen in other parts of the body. So although it blocks estrogen activity in the breast, it can act as an estrogen in other parts, such as in the uterus. So because it is an estrogen in the uterus, it acts as an estrogen in the uterus, it can cause the uterine lining to grow, and this can increase endometrial cancer. As for the venous thromboembolism, same thing here. Tamoxifen can act as an estrogen. This can increase blood clots. And also, if you take tamoxifen, it can decrease any antithrombin and also decrease protein C. As for the menopause-like symptoms such as hot flashes, the hot flashes is due to hormone levels that are fluctuating. Estrogen is a hormone, so therefore it directly relates to the hypothalamus, meaning that if there's a change in the estrogen level, this can confuse the hypothalamus and can signal to the nervous system to increase your heart rate. It can cause the sweat glands to produce more sweat in order to cool the body temperature, and thus your body experiences hot flashes. So my question is, why is it that tamoxifen can be used in the treatment for ER or estrogen receptor positive breast cancers. However, it cannot be used in ER negative breast cancers.